Hi, everyone. My name is Joe Cody. I'm the founder of Grain Fertility. I have the pleasure today of talking with Emily Guarnotta, who's a prenatal certified doctor of psychology and the founder of Phoenix Health. So, Emily, it's great to talk to you today.
You too, Joe. Thanks for having me.
Well, today we're talking about a really important topic, talking about the lingering trauma of infertility and helping people understand and heal from the emotional impact that infertility can have. And, as a former fertility patient myself, I know how the trauma of infertility can really impact you as a patient, but it doesn't just linger. During the course of treatment. It's something that patients encounter as they go through their journey. So really kind of wanted to provide you with the opportunity to give us a little introduction to Phoenix Health, the services that you provide, and then we can talk about the emotional toll of fertility, talking about how patients can deal with the trauma of this unfortunate circumstance, and then give them tools to help and heal so that they can really get the assistance and support they need as they go through that process.
Absolutely. So Phoenix Health is an online therapy practice specifically for perinatal individuals and families. And perinatal encompasses everything from going through the infertility process to dealing with pregnancy loss, all the way through pregnancy and postpartum. And we provide mental health support to individuals and families that are going through that process.
One of the things that we kind of want to talk about is, you see a lot of patients and you're talking with them as a clinical psychologist. And so kind of give us an idea of what are some of the emotional symptoms that you see most common in fertility patients?
I would say some of the most common things that we see are a lot of anxiety and a lot of depression. And often, not always, but often those two kind of go hand in hand with each other. Often by the time someone is reaching out for mental health support from a psychologist like myself, they're kind of at their just wits end. They've dealt with so much. They've been going through this process for so long. In some cases, there might have been multiple losses, multiple failed attempts. So there's a lot, almost like a sense of hopelessness and depression that comes out of that. Adding to that, the anxiety of, is the next intervention going to work? And even if it does work, there's often still so much anxiety that sticks with you until you have that baby in your hands. It's just a ton of anxiety.
Yeah, I remember, going through, and one of my friends who went through infertility also a few years after my wife and I did, he was in the period of around 4, 5, 6 weeks after they'd gotten a positive pregnancy test, but before they graduated from their clinic. And he was telling me how anxious he and his wife were, even though they had a positive pregnancy, because they had had multiple failed rounds before and they were waiting for the next shoe to drop. So this is something that, a lot of patients encounter as they go through this process. But a lot of patients, I think, as they go through this, they think, unfortunately, that this is normal, that this is a part of the process. And a lot of this can kind of be invisible. You don't see the outward signs of depression or anxiety that some people traditionally think about. So can we talk a little bit about like the invisible nature of infertility trauma, as a person goes through this and what that kind of looks like for someone so they can see, what the possible warning signs are, what are things they can do to help address that?
Yeah, I think the invisibility comes from the fact that a lot of people that are going through this process are not sharing it with everyone in their lives. So they're not sharing that they're feeling anxious. They're not sharing that they're feeling hopeless and that they're experiencing all these emotions. They feel like they really have to go through it by themselves or maybe with their partner by their side. But it's a very small circle of people that often know what they're going through. And added to that, I think there's, for some people, still a lot of shame or stigma around saying that they're going through the infertility process. I mean, we know that it's not your fault, but yet people can still feel like internalize some of that shame or feel kind of embarrassed to share that they're going through this. So I think that definitely plays a role. And I think often it's couples going through this together, and sometimes partners can cope with things in very different ways. Of course, not every couple is like this, but often in heterosexual relationships, we see that the woman might be more expressive about what she's feeling, while the male might try to remain more positive and optimistic. And sometimes that can be interpreted maybe as not feeling supportive by some people. So then sometimes even within a couple, there can be emotions, almost like your coping styles can kind of collide with one another rather than lift one another up.
Yeah, I think that's something that really resonates with me a lot, because I think my wife and I had very different approaches to our infertility journey and how we deal with that. Where, I'm a very analytical person, so I tried to take control, which isn't necessarily the best thing and something that you don't have a lot of control over, but it was a way that I was trying to cope with stuff. And I did try to have that positivity, saying, these are the statistics, these are the things that we're doing to try to do that. And so it really resonates with me when you see how different people, especially heterosexual couples, may be doing this. And, we talked a little bit about the trauma of infertility. So kind of help us understand what the trauma is that people encounter, whether it's an individual or as a couple, whether it's same sex or heterosexual couples, in the context of infertility, because I do think it's a very unique trauma that patients undergo.
Trauma is any event that happens in your life where you feel that's deeply distressing and that you might feel like you don't have the capacity to cope with it. And infertility can definitely develop into a trauma for people. I mean, it can involve multiple disappointments, multiple losses, and even just one of these things on their own can be traumatic. And then when you're adding multiple failed attempts, multiple losses, the trauma can kind of compound onto each other. Often when we're in the midst of dealing with trauma, we go into coping mode and we feel like we have to keep it together and just put one foot in front of the other. Sometimes it's not till much later on that it really hits us that we've just been through something traumatic. So it's not uncommon for people to kind of have these delayed responses to the trauma, maybe years later, months later, maybe after their baby's born. That's something that happens for a lot of individuals.
Yeah, I think that as people go through this process, they often think that, oh, once you have a child, it resolves, that your trauma is complete because the worst part of this is over. And, I think that it's completely normal for patients to either hide or shy away from dealing with the impacts of this, or not acknowledging that there are real long-term implications for this. And this could be anyone who, has a, quote unquote traditional journey, or people who are using third-party reproduction. There are long-term implications to this that are constant reminders of everything that you've gone through. And, we see that a lot right now with my daughter. She's 5 years old, but we only have one child, and we're only gonna be able to have one because it took us so long and it was so expensive. We can't do it again. And she keeps asking us for a baby sister or a baby brother right now. So, this is something that I've talked with a lot of other IVF parents about, that this is a constant reminder of what we went through. And, it's a hard thing for patients to be able to, deal with as they go through. So as they're dealing with this trauma, whether it's in the moment as they're going through fertility treatment, or the long term, for someone like myself who is years removed from resolving our family building journey, yet still has these moments that you encounter, what are ways that people can begin healing from this trauma, and how do you kind of recommend people take these first steps?
Yeah, that's a great question. I think it's very individualized. Different things work for different people. I know last week you and I had a conversation off camera, and you said you threw yourself into advocacy, and that's something that really worked for you. Whereas for another person, it might be having a safe space to talk about it, or starting a support group for other infertility families. Finding some way, some kind of purpose from your experience can be incredibly healing. Often that's not something that you're ready or able to do right away. Sometimes you need some time to get to that point. So I would say long term, I definitely encourage folks to find some way to make meaning or purpose, or to give back, because that's just incredibly healing. And it just feels really good to be able to support other people who have gone through something similar to what you've gone through. When it comes to really being in the moment, having that safe space to talk to someone, whether it's someone in your life who's just really supportive and trusting, or it's finding a therapist who understands these specific issues, or a support group. I mean, Resolve has many wonderful support groups for infertility families. Postpartum Support International also offers some. So finding ways to talk about it and begin processing your experience is also can be incredibly healing.
Yeah, I think it's fantastic. And you highlighted some amazing groups that provide resources. In Grain Fertility, we're, helping to support patients who are in the middle of their treatment process. And so we're talking to these people every single day, but we know there are differences between the individuals who are in the middle of treatment and those that have resolved their family building journey. And, a lot of the people that we see who are advocating for organizations like Resolve, things that I'm active in, a lot of them are people who have resolved their family building journey because, as you said, we just don't have the ability to face this and be as public about this because there are still stigmas associated with it. There is just the element of privacy that's required considering the intensive process that fertility treatment is. So are there differences that you see or ways that people can kind of begin to heal or address the trauma of infertility in the middle of treatment compared to those that are resolved with their family building journey and are in the next phase of their life, either as a single parent by choice, if they haven't been successful, unfortunately, or those of us that are lucky enough to have had success, and are in the next steps of our family building lives?
Yeah, like you said, I definitely see a difference between individuals who are still kind of in the thick of that active trauma and needing to just get through the day, put one foot in front of the other, try to focus on really not getting so far ahead of yourself. Like one of my biggest lines as a psychologist is to not put the cart before the horse.
Mhm.
So just really getting that like one step at a time. And getting what you need in that moment. So if it's someone to talk to, if it's medication to help with your anxiety and your stress and your depression, if it's joining like a book club, whatever it is, to get the support that you need and to help yourself be able to cope with what you're going through. And then more long term, we can look at ways to give back, ways to find meaning and purpose, and process what you just went through. The trauma of infertility will stick with you forever. There's no kind of end date on it. So it's going to be this process of really reflecting back on what you went through. And it might come up at different times in your life. You might feel like you kind of healed from it. And then, like you shared that your daughter's talking about wanting a sibling and it kind of brings it back up again. And just knowing that that's normal and that is part of the process. It really always sticks with you.
Yeah, it's one of those things where I think you're in the moment, you're so focused on everything and the singular goal of having a child, and you think that that's the end. And like when you're there, there's so much happiness, which is appropriate, especially for people who have gone through any type of fertility treatments. And it doesn't matter how short or long your journey was. You don't get a medal based on how many failures you had. Everyone's trauma is real and should be acknowledged. And so as you go through this, you mentioned some organizations that you said provide, whether it's support groups or resources. Are there places that you kind of help direct people to start this journey? Because I think everyone probably has different ideas or understandings of what healing looks like, and they may not necessarily be at that point or want to do a conversation with a psychologist or do online therapy or in-person therapy. But are there good resources that you recommend people to kind of start to understand what they may be dealing with and give them the resources and tools they need to be able to make those steps to help address some of this trauma?
Yeah, definitely Resolve is a wonderful organization for families that are on this infertility journey, and they offer a lot of resources and education and support. So that's something that I really recommend to the families that I work with. And Postpartum Support International also helps support families going through infertility, but they place more of a focus on that post infertility journey when you've had the baby. People that have gone through infertility are actually at higher rates of experiencing perinatal mental health conditions like postpartum depression and anxiety. So it's really where that can stick with you. So if you find yourself experiencing what you think might be symptoms of something like that, then reaching out to an organization like Postpartum Support International is wonderful. And with the advent of the internet, there are just so many great resources. Like your company, Grain Fertility, is wonderful, and there's so many out there that you can get connected with, or just find people online who have been on a similar journey to you that you can reach out to and get some support from.
No, I think it's fantastic. And we will be providing links to these organizations in our YouTube videos. That way people can link directly to these organizations. And at Grain Fertility, we also have created a list of different support groups for individuals, whether it's we're trying to really identify with people and their unique journeys, knowing that donor conceived and intended parents are different than a member of the LGBTQ plus population, which is different than military families or BIPOC families. So we really have tried to put together a curated list of these different support groups that are, can help people with their individual journeys, considering no one journey is like other people's. And so we want to ensure we have resources available to them. And if people are interested in learning more about Phoenix Health, and they want to get help, where can they go to find more about you, Phoenix Health, and what are the steps that you have for someone to get started?
Yeah, you can find us at our website, which is joinphoenixhealth.com. And you're welcome to reach out. And basically, we do a brief assessment and make sure that you're a right fit for our practice and make sure that we're a right fit for you. I think really having that therapist-client match is very important. So if you're looking for something specific, we want to make sure that we're able to provide that. And then we offer individual therapy. We also offer support for couples and families. And we also understand that the infertility journey, like you mentioned before, is quite expensive. So we do try to make care more affordable by accepting insurance as well.
That's fantastic. I think any way that we can work together to provide access to these resources. And I think when the infertility journey, we often only think of the medical side of this, the clinic delivering care, but there are so many aspects of the journey that patients are on their own trying to find stuff. And this is why Grain Fertility was founded is, as a patient, I struggled with dealing with all the other aspects of the care, trying to keep everything organized, trying to find what are the appropriate resources. We found the therapist that my wife and I went to through Resolve, and then she actually, provided me a link back to do advocacy work with Resolve. But the fertility clinics only provided us with kind of a list of potential resources on a piece of paper, said go find it on your own. So we really want to try to make it a lot easier for people to navigate and find all of this stuff, so they don't have to spend a lot of time and energy trying to find what's the right fit for me. Instead, they can focus on what matters most, which is addressing their physical, mental, emotional needs as they go through the fertility treatment process. So we'll link to Phoenix Health site also, and we have a new blog post up on the Grain Fertility website talking about this, and this goes a little more in depth about some of the aspects that Emily and I talked about. And is there anything else that you'd like to kind of finish up on? Any last words or anything else that you like to tell patients as they undergo treatments?
Yeah. Just encouraging people to know that they're not alone, because it is such a lonely process. And there are so many people out there in different stages of their journey. Some are in the same stage you're at right now, some are in a different stage. And just knowing that it's not, as much as you feel like you're all alone, it's not just you, and that there is a world of people out there that know what you're going through and are here to support you.
That's fantastic. And thank you for all you do for patients. I think the resources that you're providing for people are literally life-saving in some cases. And I think it really does help equip people with the tools, resources, and support they need to be able to continue to move forward in their family building journey. And whatever that resolves, like, they have the resources available to help them, prepare for the next phases of their life. So thank you so much for all that you do. And thanks for taking a few minutes out of your day to talk with myself and then some of our members and anyone else who may be needing access to resources.
Thank you.
Thanks.